Thank you, Rajul. Since the Somalia famine in 2011 and a crisis of slightly less severity in the Sahel a few months later, there's been a lot of buzz around the notion of resilience, around building resilience policies and programs that make people more better able to withstand shocks and to recover more rapidly in their aftermath. And the United States government has invested heavily in this, as have other donors. And over time, we've seen the emergence of programs that not only emphasize livelihood diversification or production kinds of activities that are more traditional, but also things like improved market access, access to financial services, index-based insurance programs for both crop producers and livestock, backed up by strong state-led social safety net programs that assist poor, vulnerable people even in good years, but can be scaled up rapidly to support a humanitarian caseload, or what would have been considered a humanitarian caseload in bad years, with flagship programs, at least in Ethiopia and Kenya, and more fledgling ones elsewhere. These programs have had a big impact on food security, on income, and on access to services, etc. In normal times or in crises of modest severity. But a couple of points here. One is that we're not quite sure what the impact is of these programs in the kinds of crises that we're seeing now. Clearly, resilience programming combined with early intervention in the humanitarian sense has been shown in crises of all magnitude to reduce vulnerability. I think the jury is still a little bit out. A number of people are looking right now into what has been the impact of this investment, given the magnitude of the crisis that we have now, even in political stable countries in the Greater Horn of Africa and in the Sahel. But the second point, and perhaps bigger one, is that the kinds of shocks that these programs help to make people resilient to are not necessarily the kinds of crises we're dealing with now. A constant theme across the whole panel here has been about the role of conflict in precipitating the kinds of crises that we've seen today, and that brings me to my second point, which is what kinds of shocks can we help people be more resilient to? And we need to think about that carefully in these cases, because conflict is the common denominator across these four crises, and we haven't even mentioned Syria or CAR or a number of other places. Weather is certainly partially to blame in Somalia. Economic collapse plays a big role in what we see in South Sudan. But in all these cases, we're talking about a state that may not have the capacity or the political will to manage national safety net programs. And investment in resilience programs is certainly a lot more tricky. I have always advocated that many of the lessons that we've learned about resilience in climatic or environmental crises can be translated into more conflict-related or political crises. But it's a different challenge, and we have to think about what we are building resilience to. You know, in Yemen, which is by far the biggest risk in terms of the magnitude and the possible repercussions, we're talking about aerial bombardment and a naval blockade and the destruction of port facilities in a country that's dependent on imports for probably 80 or 90% of its food stock. How do you make people resilient to naval blockades and aerial bombardment? I mean, clearly you don't. The same thing in South Sudan. You know, how do you make people resilient to repeated violations of international humanitarian law or widespread displacement of rural populations in the Equatorials? So, I mean, I think we're talking about crises here that are first and foremost about protection, and secondly about conflict resolution and bringing these things to an end. Lastly, and maybe we can come back to this later, I fear that we are making a little bit too big of a deal about the difference between what's a famine and what's something else. We all knew there was a big problem in Somalia in 2011, but the international community didn't really ramp up to engage with it until after a famine was declared. Now, I know that there are lots of people, including some people here in the room, who were working hard to put in place the kinds of policies, the kinds of procedures, etc., that would have enabled a more rapid response. And we saw a similar kind of thing when a famine was declared for a limited population in Central Unity State earlier this year in South Sudan. More money was available, and there was greater concentration of those resources to the affected population. Famine is qualitatively different from a sort of, just a bad year or a bad season. The people that survived the Barghazal famine in 1998 described it as like falling off a cliff. Our book goes into a lot of detail about the total collapse of social support networks in Somalia. But the difference between the qualitative and the kinds of quantitative thresholds that we have that define what's famine and what's not are rather different, and I think we need to be careful that we're sort of defining phase 4, which is the next phase below famine, as being a success or something to be proud of, when in fact it really isn't. So I think we need to look at the totality of these crises and not simply the level of severity that we're used to looking at.
Ben, thank you so much.